My name is Edward Cho. I'm the Chief Operating Officer of Air Visits. I am a dual board certified emergency medicine and family medicine physician and with an MPH in health management. Air Visits creates a system that allows the continuity of care from the hospital to the primary care clinics. I recognize that my experience in emergency medicine and my experience as a family medicine physician recognizes that there is a disconnect between what happens when patient is discharged from the ER and when patients are seen in the primary care doctor. Oftentimes that their interaction with the healthcare system is only in the emergency department, and so their acute care needs are only addressed, while their long-term care needs are not. What that leads to is poor health outcomes and poor care because they just bounce back into the ER when they need it, while they should be managed over the long term and their care should be given over the long term. I feel that Air Visits provides that solution where we get them back into the system, get them the tests and the referrals and the specialists they need in order to solve their healthcare needs. And this is something that I feel that the rest of the US healthcare system can provide also. And we at this control center allows that facilitation to happen. The control center interacts with the patient, motivates the patients, and gets them to do the tests that they may not see the value in, but we see the value in the long-term care of their medical problems. And this interaction is what allows to better care. It's getting them to do the tests that they need in order to address their long-term health problems. Air Visits sits right in the middle between the silos of the hospital and the primary care physician. That connection, that continuity is integral in making a healthcare system a system and allows that connection for testing and management to happen. Without that bridge to make that connection, it will continue, US healthcare system will continue to be fragmented and will still result in poor healthcare. I would like Air Visits as a control center as we interact with the patients, to be a motivation for the patients to get the health care that they need, to be the glue that connects the pieces for all the different components of healthcare delivery, to be that motivation to get patients to be more healthy, to take more of a proactive role in their healthcare. And we will allow not just the motivation, we will not only just give the motivation to them, but also motivate them to recognize themselves why it's important for them to do these tests. I believe that Air Visits can provide that component of healthcare that's missing, makes the health system a health system, makes a standalone hospital interact with their patients in a different way, to create that vertical closed system where patients will interact with their hospital and their primary care doctor in a way that's easy for them to get the health care that they need.